Hey everyone, I'm Mariana, the founder of Bird Physical Therapy, and I am right here in Brazil at the beach doing what I love to do, which is virtual physical therapy.
Hi, Mariana. My name is Sade. I know we spoke through emails. I'm glad we were able to schedule this meeting because I'm so excited to learn more about virtual PT. So, Mariana, I have a big question because I know the traditional way to see a physical therapist is to go into the office. And so, I guess my biggest question is what's the difference between a virtual and the office visit? Can you just maybe paint a picture to kind of help me imagine like what a virtual PT session will look like versus a in person?
Yeah, so talking about our practice, comparing to a traditional PT clinic, we, the physical therapists, are going to provide the client undivided attention. So we are going to have a physical therapist um, looking at you, correcting you, assessing you 100% of the time. And versus in a traditional clinic, the physical therapist, uh, a lot of times they have to see two or three patients at the same time. They have to supervise the physical therapy assistants. They have to catch up on their notes, do reevaluations, evaluations. So they have a lot of things going on at the same time. So I think one of the benefits of the way we provide a visit is virtually you're going to have the physical therapist just there for you. So um, allowing the physical therapist to provide a better quality of care. Our average visits a week is one visit comparing to two or three times in a traditional physical therapy clinic. So you would have to go more times, dedicate more time of your week to go to this clinic. And while you can do virtually from anywhere once a week, and our average total number of visits would be about six. Of course, everybody's different depending on the situation in the case, but comparing to a traditional way of treating is usually like 12, more or less. So uh, it would save you time and also like some money comparing the total number of visits. And the difference is that doing virtually the way we do it, I'm going to talk to you a lot, educate you, explain you, answering all your questions. So you are going to be empowered to learn what you should avoid, what you should do to improve your pain. So that helps also on the prevention aspect of things. So once you learn what movements help you, you can always do them. If you're feeling you slept and you wake up with some stiffness on your neck, you already know what you have to do because you already had the problem and we talked about it. I answer your questions, you know the exercise, so you just go and start doing the exercise and you don't have to go in a clinic and depend on a passive treatment and on a physical therapist. So that just facilitates the whole process and helps you to solve your problem quicker and save you money on the long run as well. And a lot of studies has been also showing, I'm going to just mention one really quick, was published in the Spine in 2011 by Peterson, and they compare McKenzie with manual therapy. And they show on this study, for example, that the McKenzie had better outcomes in a short period of time than manual therapy. So I think I know it's hard to imagine that because everybody associates physical therapy with manual therapy, but we had very good results just using an exercise based approach. And through this approach, we can give you a better, less long result because you are able to do all the exercise and you don't depend on a passive treatment and someone doing it for you. So you take control of your pain, you are empowered to exercise and do everything at the comfort of your house or of your work. So I know I talked a lot, so just let me know any other questions you have.
So, like, just hypothetically, what if I just had some dying, urgent questions like in between sessions? Would you be accessible in between?
Yeah, so what happens is you're going to be able to communicate between sessions through a secure messaging portal. So you're going to be able to reach me out with any questions, any concerns you have. So how it works is you're going to have a homework to do after our visit, and then I'm gonna send you some videos that you can watch and kind of remind the exercise that we talked during the visit. So that will help you to make sure you are executing the exercise correctly. And then also, if you feel like your response is not appropriate, or if you have any concerns, you can just message the physical therapist.
Okay, that sounds really good actually. Just some accountability in between sessions that I know will be helpful in my progress. So I'm really excited, and so I guess my main question is, how do I schedule a session?
So you can schedule a session through our website. So there is a place you're gonna find on top of the screen that says book an appointment. And then when you click there, you're going to be able to choose the best time that fits our schedule.
Well, thank you so much, Mariana. I learned so much about virtual PT, and I'm excited for my first session. So I'll see you very, very soon.
Great. I'm looking forward to working with you. Just remember, charge your phone or your computer, whatever you're going to use it. Make sure you have good internet connection. And I'll see you in a bit in the office.
All right, thanks.